Hey, this is Tyler with Southern California EMS Training Institute. In this video today, we're going to be talking about pulse and how to adequately assess a patient's pulse. When we're assessing pulse, we're looking for three things specifically. We're looking for the rate of the pulse, we're looking for the rhythm of the pulse, and we're looking for the quality of the pulse. We have three different locations that we're really going to focus on today with where we can actually assess for the pulse. The first one is going to be your carotid artery, right? Your carotid artery lies just on either side of actually your trachea. So if you can find your trachea, you go to either side and you're going to just gently push down until you can feel that heart rate or to feel that pulse rate. That's going to be your carotid pulse or your carotid artery. This is also known as a central pulse, typically the one we would feel after CPR because it's closest to the heart. It's a strong pulse and it's a good one for us to feel. So that is again one of your central pulses and again your carotid pulse. It's best when feeling for a pulse to do it with only two fingers and never your thumb. That is going to be our goal here when we're assessing for our pulse. Our next pulse is actually going to be our brachial artery. Your brachial artery lies just underneath your bicep. It kind of just follows the curve of your bicep around and kind of comes right down through here in your elbow. Your brachial artery is going to be a good one to feel, especially for kids and infants. When we're checking our brachial artery, we should find it just on the medial or inside aspect of your arm. You're going to push that bicep out of the way just a little bit, and you should be able to feel that brachial artery. You can move your fingers up and down until you can feel it nice and strong. That's how we're going to assess your brachial artery. This is a good artery to feel prior to assessing your patient's blood pressure. Your radial artery is actually located in your wrist. And so when we're actually feeling for the radial artery, your radial artery is always on your thumb side because it's rad, right? But we're checking for your radial artery. This is your brachial and your radial arteries are known as peripheral pulses because they're a little bit further away from your heart. But in this situation, you guys, it's on the medial side, all right? I guess I should say lateral side, but on your radial side of your forearm, on the thumb side, and it's going to be located on just one side of that wrist. Now you can feel that you have a bone that lies right against the outside of your arm, that's your radius. And so if you go just inside of that bone, that's where that radial artery runs. So we're going to use two fingers again to assess this pulse. And we're going to go ahead and we're going to assess our pulses whenever we're feeling for a pulse for 30 seconds. And then we're going to multiply it by 2 to get our rate. Remember, that's the first thing we're looking for when we're assessing the pulse. We're looking for the rate of the pulse. A normal pulse rate for an adult is going to be between 60 and 100 beats per minute. And so we're going to be assessing that to make sure that that heart rate does lie hopefully somewhere between those two ranges. Now again, we're only assessing it for 30 seconds and we're going to multiply it by 2. Now we also want to check for the rhythm. The rhythm is the regularity of it, right? Does it beat very regular like a metronome, right? Or is it very irregular? Is it kind of beating, right, maybe not on tempo, and it's just a very offbeat, off-tempo type of assessment of that pulse. Last thing we're going to be assessing for is the quality. Does your pulse rate feel strong? Does it feel weak? Some people will describe it as thready because sometimes you can feel it, but it just feels like there's a thread underneath the skin and not a big, strong pulse that we would typically feel. So when we're assessing for pulse, you guys, we're looking for the rate, the rhythm, and the quality. All right, we're going to assess the rate, how many times it beats per minute. The rhythm, is it regular or irregular? And then the quality, is it strong, weak, or maybe thready, as well as we're feeling that pulse. All those can kind of elicit or help us to decide exactly what's going on with this patient. So it's really important that we do take the time to assess and get adequate pulse rates of pulse assessment when we're dealing with our patients. Again, that's Pulse with Southern California EMS Training Institute. Thank you very much.